let's begin. First, we'll welcome David Gustafson and Fiona McTavish to the podium from the Mobile Health for Alcohol Addiction from the University of Wisconsin. Thank you so much for coming.
Thank you. We want to stop people from relapsing to drug and alcohol abuse, and we did that with a smartphone app we called HS. When you were in grade school, I'm sure your teacher probably asked, what do you want to be when you grow up? And I'm also sure nobody raised their hand and said, I want to be an addict. And yet, substance abuse disorders are at epidemic levels. In 2015, over 33,000 people died from opioids, nearly half of those deaths from prescription drugs. 23 million Americans need substance abuse treatment, yet only about 10% receive it. Unlike other chronic diseases, aftercare appointments and ongoing monitoring are not standard in the addiction field, even though most research indicates that long-term participation is associated with better outcomes. The addiction field, though made up of caring and passionate people, is characterized by high staff burnout and little success. With these issues on our mind, we convened a group of addicts, family members, and experts outside the addiction field and gave them one task. Imagine everyone working in the addiction field passed away. You must develop a treatment system that functions mainly through technology. We came away with a vision for a smartphone app for substance use disorders. Smartphones were generally not available back then. With grant funding from SAMHSA, we developed HS and tested it in a randomized trial. Using the phone's GPS, HS vibrates if I enter a high-risk zone, such as the bar I frequented. I check it and see, hey Fiona, is this a good place for you to be? Someone else may see a video of their 4-year-old son saying, Daddy, I love you. What appears is tailored to the individual, reminding them of their motivation and disrupting that urge to use. There are 15 services in HS, but the discussion board is the heart of the system. It's where participants can anonymously give and receive support from others. Janice posted this at 4:41 a.m. Once again, I wanted to pick up crack. The name alone speaks for itself. Broken, garbage, destroyed. I want to be whole, not garbage. I feel confused sometimes. Thanks for listening. I needed to share. I didn't pick up. Immediately, she received numerous messages of support. HS has a panic button that I can press if I'm struggling. I answer a couple of questions and am given several options. It may be to reach out to others. I can instantly send a text to my supportive friends that I programmed into HS that says, Fiona's struggling right now, please reach out to her. If I prefer, I can edit that and then send it. While waiting for a response, HS directs me to materials such as guided relaxation, games, or personal stories I can listen to of how others dealt with urges and helping me move beyond mine. We conducted a randomized trial with 349 people. Participants randomized to the experimental group had HS for 8 months. The control group had treatment as usual. Our results? HS reported 57% fewer risky drinking days and 30% improvement in complete abstinence. HS has been used by drug courts, which found a reduction in positive drug screens in high versus low HS users. Staff reported that HS became an extension of their team, created stronger ties, and improved treatment engagement. In a treatment center in Appalachia, treatment retention rates were more than doubled for opioid-addicted young women using HS versus the control group. In a VA pilot study of 47 alcoholics who were referred to as frequent flyers because of their heavy use of the VA health services, received HS plus meds. This study showed an 80% reduction in hospital admissions from the previous 18 months. HS is used by over 6,000 people in treatment agencies nationwide, as well as in Canada and New Zealand, and we continue to grow. We currently have 4 additional clinical trials using versions of HS. We continue to improve HS. One way is by predicting relapse. In real time, HS uses machine learning to analyze discussion group posts and use those results to predict and, most importantly, intervene to prevent a relapse. I'll end with one last discussion post from Joel. He wrote, "I just want to thank you. At first, I was just interested in the phone. I've been an addict for 42 years with no more than 1 week clean at any time. I don't do well in groups, so I tried HS. December 4th will make 18 months clean. So again, thanks. Thanks for this opportunity."
Thank you so much for that really inspiring story. Do you have any questions?
Well, there's one question we're all dying to know the answer to. One of the criteria for this award is replicability. And we were told by the site visitor that no one else can access your application right now. It's only for research groups. So we're scratching our heads and wondering, well, when will it be available to others, and how could it be replicated, and when?
Actually, we probably didn't do a good job of answering her question. The University of Wisconsin and the research that we do is a research activity, but the university did license the product to an organization that is now marketing it. And in fact, they're the group that is primarily responsible for the 6,000 people who are using it now.
Can you tell us, is it a nonprofit, a for-profit?
It's a for-profit.
Mm-hmm. Okay.
Yeah, I should say it's a Type B organization, which means that the board doesn't have a need to maximize profit. It can use other criteria for its success.
So it is now on the marketplace?
Correct.
Yes, okay.
On the marketplace as an app or to be used with a specific phone?
The only way in which the system is currently available is through addiction treatment agencies. And so an agency can take it and provide it to their customers.
As an application to
As an
just-
application.
Okay.
So
the phone is no longer always necessary then?
yeah, the phone continues to be necessary, always will be,
But
because
to be provided by?
yeah,
Right.
You can download the app onto your own personal smartphone?
yes,
Through the treatment agency?
through the treatment agency. We do that to protect the confidentiality of the people. We don't want it to get out and be used inappropriately, and so it has to be vetted by somebody.
And could you give us some examples of the treatment organizations that have started to use it?
Sure. S-Star, which is a very large treatment agency in Fall River, Massachusetts, is using the system. They have about 900 methadone patients a day that they treat, as well as patients that are on Vivitrol and other kinds of medication. There's in Cape Cod, Gosnold is a treatment agency that is using it. Kentucky River Community Care is another one. Optum, which is a health insurer, is pilot testing it. Tufts Health System is pilot testing it. So, the organizations, is that enough, or I can go on if you want?
Maybe, and underneath my question perhaps is, I'm wondering, you really impressed me with the potential for low-cost replicability
Right.
and wide dissemination.
Yeah.
And I'm curious about how having this private Type B organization be the marketer, whether or not that's going to disrupt that low-cost feature.
I think because it's a Type B organization, price is always going to be a very low amount of money. I really can't tell you exactly what the cost is, but I think it runs something in the vicinity of $8 a day, $8 a year for access to the system per patient. And so I think it's,
I call that low cost.
we understand that this is a population in desperate need, and the agencies themselves are anything but rich. And so the idea is to disseminate it widely, first and foremost.
One thing that your write-up said was that participants in the various interventions that you've tested use the discussion groups more than any other service.
Correct.
And I wasn't clear, is that sit down with a group, discussion groups, or is that on the phone? How does that work?
Yeah, the way it's first, there are two kinds of ways they can use it. One is they can use it as a personal message to one individual or a couple of specific individuals within the group. We call that private messaging. The second way is to the large group. The way in which it's done is you just either dictate or write messages on the phone, and then it gets sent out like you would if you were texting or doing things of that type.
Yes,
Question?
go ahead.
Yeah, as it's being used, you'd mentioned, Fiona, that you're moving to a place through the technology where you can begin to predict relapse. As this is being more frequently used through these drug treatment centers, how is that information about what you're learning about the usage of the application coming back to you and refining what you're doing there?
You want to get that? Or?
Yeah, actually, you hit on, I think, an exciting point, because right now we have over 4 million data points that have come from the use of the system that comes back to the university, and we're able to use those data in a variety of ways to better understand what the relationship between various things and addiction. For instance, one of the biggest predictors of relapse is whether the number of swear words that a person uses increases over time. And that explains, for those of us who are statisticians, which I'm not, explains about 44% of the variance, which is a humongous predictive capability on that one item alone. And that came from the analysis of those data. So then what we do is we look for swear words.
Right. Thank you.
I think the write-up said there were something like 100 other apps out on the market.
I think that's a big underestimate.
Pardon me?
It's a big underestimate.
Yeah, but
Thousands, probably.
does that, how is that going to affect the replication, the use of yours? Is there so much noise out there from other apps that are inferior to yours that you worry about that?
I think that any time that there is apps out there that, I'm not worried about the good competition. I'm worried about the apps that really aren't any good. The more we can get good apps out there, I don't care whose it is, it's important to get it out to the people. One way in which we tend to differentiate ourselves is because of the research that's behind this. You know, we have a lot of randomized trials. Nobody else has done that. That can provide evidence of the impact of the thing, and I think really that's a major differentiator.
And I would say one other thing is, honestly, if we help other apps to become good apps, we're just helping more people. So.
Great. I guess the question is, now if we give you the award, it's really helping a private company in a sense. So it's which is different than, usually we give an award to, you know, a government agency that does something. And so this is something we've never confronted before that I know of.
Well, the award wouldn't go to the company. You know, what it would do is go back to the University of Wisconsin to continue our research in addiction-related work. And so I think there's a big differentiation. There's a pretty good firewall that's been created between the university and the marketing organization. But, you know, if you want to get something out there and you get it widely disseminated.
No, I understand. It's not your issue, it's our issue, I think, at the moment. And I think it's, when we read about it, we were thrilled to hear what you've been able to accomplish. I mean, it's really groundbreaking and fabulous
Cool.
what you've been able to do.
Thank you very much.
Thank you so much.